A new program started by pediatric residents from Alberta's Children's Hospital is aiming to help teens understand the science of mental health issues. Here's some numbers for you. 1 in 5 people will experience a major depressive episode in their lives. 1 million people aged 9 to 19 have depression in Canada. And while these stats prove how common it is to struggle, this program is aiming to close the loop in communication. Dr. Rebecca Hay is one of the residents behind the program, and she joins us this morning from Calgary. It is very snowy here. I don't know what it's like in your part of the country.
It's still dark, so I haven't looked outside, but I hope not as snowy as it is for you.
Well, fair enough. Thanks for waking up dark and early for us. Let's talk about the program. It is called Stress and the Brain, and I love this. We often talk about mental health issues. We encourage kids to talk about them, but we don't often explain the science behind them. Why is it important to learn about it?
Yeah, that's a great question. The program was adapted from one from the Society for Neuroscience in Ottawa. And our goal, as you mentioned, was to educate and destigmatize mental health. And we found one of the best ways to do that is by explaining the science behind what's going on. It helps take away that stigma of it's just in someone's head or it's someone's choice. It's making it a very real, very physical thing, which it does have physical changes in the brain. And we know that you can also rest and recover, which can also be from changes that happen in your brain towards recovery. So framing it in that science kind of helps relate it to other things that we see that cause changes in your body too.
And it makes it very real, as you said, right? It's not just a feeling or an emotion. There's actual science, and there's actually physiological things happening in your body that contribute to this. Your presentation also touches on stress responses that our nervous system can have, like fight or flight, we know, or rest and digest. What should teens or adults be aware of?
Thank you for bringing that up. That was one of my favorite analogies that we did in the presentation because when you're making the link between the science of stress and the symptoms of depression and anxiety, we make a connection between fight or flight and rest and digest. Because if you think about it, if you encounter a bear or a giant snowstorm, I guess as is happening, it can trigger like that fight or flight stress response. And people can notice things like sweaty palms, racing heart, racing thoughts. Their stomach may hurt because the rest and digest system is turned off. You don't want to be digesting a burger when you're running from a bear. And it helps because those are also the physical symptoms we see in anxiety. So it helps people make the link because we know in anxiety, it's more of like that stress response can't turn off and you're seeing bears everywhere. So it helps kind of connect those physical changes, as you mentioned, and the science behind it to where people may have actually felt that and say, oh, that makes a lot of sense.
You've given this presentation to junior high schools and middle schools across Calgary, and you've expanded into webinars. It also includes families. What's the reaction been like from the young people to this program?
Yeah, it's been really great. I think that teens are so insightful and they actually already know so much about mental health. I think that the culture luckily is changing where it's becoming more and more open. But the most striking thing that we noticed is a lot of teens didn't know how to or where to access help. So the biggest thing that's come from these presentations is saying like, oh, I can call that number or I can call that number from my friend or now I know what resources are available when I chat with my teacher and my guidance counselor. So the biggest reaction has been the improved access to resources. And we had one meme in our presentation, and that's always a big hit. But it's really those access to resources. I think that's been the biggest feedback we've gotten from youth.
We know that the percentage of children and teens that experience depression and anxiety symptoms doubled during this pandemic. That's according to a University of Calgary study. What do you want to make sure that teens or families who come through your program know about access to resources? Because it can be challenging. I mean, if you're looking for a psychiatrist, for example, or a mental health expert, the waiting list can be long. So how do you connect people to resources to get immediate access?
Yeah, it's so tough because, as you mentioned, our mental health resources right now there's such high demand and they're so stretched. So what we've done is there's a lot of groups that are specializing, for example, in teens and adolescents. So we'll refer to adolescent medicine specialists who can also help connect with psychiatrists and mental health specialists and do a lot of that counseling themselves. There's also a lot of really great resources online that come with like free mindfulness apps. There's free free cognitive behavioral therapy and other forms of therapy that you can find online as well that are more immediate access. And then, of course, in a crisis, if someone's really afraid for safety, there's always like the distress center and other phone numbers that teens can call when they're in an emergency right away. And hopefully by providing some of these resources, it gives a bit of a safety line while they're maybe on a waiting list to see someone else, and helps prevent kids from being admitted into hospital.
Dr. Rebecca Hay, it's an important program. Thanks for coming on your morning to tell us about it. And to help out with that, we're going to link a list of resources to our social media pages. Thanks so much.
Awesome. Thanks so much for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.